A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Start with the name of Allah, who is very merciful and very, very kind. And CME update by Mother and Child Survival Group of Pakistan, me Dr. Tariq, Ops Gynae Family Emergency Specialist Internist, Gulf KSA, presently a district gynecologist. The CME update today is an important update, which is Hirsutism. Hirsutism is a male type of hairs present in the woman due to the androgen excess. The prepubertal downy and unpigmented villous hair went into terminal coarse hair, which is present in the face, on the face and the body of the woman. It's known as hirsutism. It is due to the increased sensitivity of 5-alpha reductase, or because of the increased androgens. Androgens, as you know, is prepared from the ovaries, adrenals, and also from the testosterone, from the peripheral conversion. From testosterone, it is converted to androstenedione, and from androstenedione to androgens. So this increased sensitivity or increased production of the androgens, leading to male type of hairs, which is known as terminal hair, which are coarse black hairs. So the important thing is the turnover of, and it is also very important, it has to be differentiate between hypertrichosis, which is an organic disorder, and sometimes it is congenital as well, in which there is a coarse growth of hairs all over the body like a werewolf appearance, hypertrichosis. And also to be differentiate from virilizing, because virilizing, sudden appearance of virilization like male body habits, clitoromegaly, and deepening of the voice, and all these things are related to male habitus, and it can be due to some ovarian tumors producing androgens, testosterone. So these must be differentiated with the virilization and hypertrichosis. So this male pattern hairs on the woman face and on the body, which includes upper lip, chin, chest, upper abdomen, lower abdomen, upper back, lower back, and others. And according to the Free Galway score, 9 locations like upper chin, lip, chest, upper back, abdomen, and upper back, lower back, and upper abdomen, lower abdomen. If the score is more than 8, then this shows signs of androgen excess, hirsutism. So hirsutism is basically an important part of hyperandrogenism, and it is associated with polycystic ovary disease, with acne, alopecia, and deepening of the voice. So, and also it is because this male type of hair, if it is even present in mild to moderate form, this causes a mental stress, and it is estimated to be present in 10% of the women, this male type of hair present on the face and the chin. And the score I have already told you, Free Galway score, which is more than 8, shows excess androgens. And if it is growing more, virilization signs are growing more, then ovarian androgens has to be tested for a rapidly enlarging ovarian tumor producing androgens. associated with hyperandrogenism, associated with PCOD, and all these, and also with congenital adrenal hyperplasia, and also with Cushing disease, and also with hyperprolactinemia and hyperinsulinemia. All because of these are associated with, I have shown you the difference between virilization, hypertrichosis, and alopecia, and this male type of hairs and acne and all these. These causes of these are ovarian. It can be luteoma. It can be ovarian producing tumors. It can be hyperinsulinemia, and also adrenals, congenital adrenal hyperplasia, and ovarian producing androgen producing tumors, and liver disease, hypothyroidism, and all these are an increased glucocorticoids, increased progesterone and androgens, and in which the important thing is the increased sensitivity of SHBG, and increased sensitivity also 5-alpha reductase, which leads to increased production of this androgens, and thecus LH also stimulate theca cells to produce androgens, and glucocorticoids also causes this. Cushing's have these effects. So there are certain diseases like liver disease, hypothyroidism, and these have got increased level of SHBG, because SHBG is the one in which the testosterone binds, and it is the free testosterone which is very active and responsible for all these activities. And there is a decreased level of SHBG, which is in the congenital adrenal hyperplasias, hyperinsulinemia, and hyperprolactinemia, and all these liver diseases. So in all these increased level decreased level of SHBG. And then there are glucocorticoids, increase in the level of progesterone and estrogens. Now as we have told, there is some ethnic differences as well in these type of Hirsutism. In some Mediterranean women, they have the increased amount of black hairs and Hirsutism as compared to the others which have less one. This is due to the ethnic differences, and also because of the level of sensitivities of the 5-alpha reductase, which is ethnically different. And then we have to find it out what type, and we have to differentiate it from hypertrichosis and virilization, which already did. And then we have to see the age in the menstrual history, oligomenorrhea, oligomenorrhea, and menstrual irregularity. And then age is very important, and in which, if it is, and rate of symptoms of also very important, then it points to the rapidly enlarging ovarian tumor producing androgens. And age also, which for the children, congenital congenital adrenal hyperplasia, and then signs of mental stress due to this hirsutism, and also it is 10% present in the, and then there are drugs also which would like glucocorticoids, anabolic steroids, and also some other drugs as well, which helps increases the level of these androgens. And then we have to find out virilization, which is male type of habit is acne and clitoromegaly and deepening of the voice. So and then drugs, tumors, and rapidly enlarging tumors producing androgens and testosterone. So now with all this, we have to come for the treatment. There is a first line of treatment and there is a second line of treatment. The treatments are because of the underlying cause. So treat the cause. Otherwise, you can give this combined oral contraceptive pills, those who are not trying to conceive, and then they also reduces the level of SHBG and all these 5-alpha reductase. And then comes the there is drosyperinone with the ethanoestradiol and cyproterone acetate with the Dianet. So these are all helpful in hirsutism. And then there is medroxyprogesterone and progestogen. It is given, and it also leads to, but it also leads to reduction in the hirsutism. The mechanism is the same as that of COCP 5-alpha reductase inhibitors. And then comes the electrolysis measures, shaving, waxing, tweezing, and all type of. And you see, it is very important that this hair papilla should be destroyed. Then it is permanently destroyed. When this dermal papilla is permanently destroyed, then in the hirsutism this stops. So dermal papilla is very important. It is destroyed by the laser 694 and 1024, and also by the electrolysis, electric cautery, and the current is applied in which the dermal papilla is destroyed. And then comes the second line of drugs, which are included as the 5-alpha reductase inhibitors, spironolactone, aldosterone antagonist, and in which then you have to add contraception. And then also second line of drugs are this finasteride and flutamide. These all has to be added contraceptives, and they also reduce the level of the 5-alpha, inhibit 5-alpha reductase activity, anti-androgens. So reduces the androgens. And then we have ornithine hydrochloride, which is basically disturbs the decrease in the hair growth, and it is best for also for menopausal. And then we have got GnRH analog, which add back therapy. And then last of all is the ketoconazole, which disturbs within destroys the hirsutism by another metabolic pathway 450p cytochrome enzyme. This destroys it. And then we come with last of all, postmenopausal has 70% incidence of this hirsutism. So for that, this 5-alpha reductase aldosterone antagonist and cyproterone acetate and dorsiperinone and these phenytoin are very effective. So this is a very important topic. Hirsutism, very common. It causes mental stress and other physical stress as well, and daily male type of hairs, leads to excessive shaving and removal of all these, and the others resistant to the treatment and to the cream has to sort it out the cause, which are briefly really reviewed here. So we'll update with another one, and another CME takeaway message is pray, praise, trust, love, talk, worship Allah, follow Asu Asna sallallahu alaihi wasallam, our health and survival, and we must not forget our glorious past. Ala bazikr Allah tatmain qulub wa kufa billahi wakila wa kufa billahi नसीरा सुबहान अल्लाह व बिहम्दिही सुबहान अल्लाह अज़ीम. दुनीम इनकी ठोकर से सहरा और दरिया, सिमट कर पहाड़ इनकी हैबत से राई. And so our glorious past, and talking, praying, worshipping, and asking from the God Almighty, to whom we are, we have to always to be directed. हम तो माइल बकरम है, कोई साहिल ही नहीं, राह किसे दिखलाएं, राह बरे मंजिल ही नहीं. And then we come with the end of this. Thank you very much. Assalamu alaikum for a patience listening, and then we will review with another one. Till that, goodbye, best of luck. and Vama Alena Illal Balagh.